Good day to everyone. My name is Micah S. Aripin, reporting the topic about pneumonia. So, my learning objective would be to define the pneumonia, describe the different classification of pneumonia, and use the nursing process as a framework for care of the patient with pneumonia. So, let me discuss first what is pneumonia. It is an inflammation of the lung parenchyma. When we say lung parenchyma, it is referred to the parts of the lungs that involve in gas transfer, like alveoli, alveolar ducts, and respiratory bronchioles. So, what is cause of inflammation or pneumonia? It is caused by the various microorganisms such as viruses, fungi, mycobacteria, and bacteria. So, next is what is pneumonitis. Pneumonitis is an inflammation process in the lung tissue that may predispose or place patient at risk for the microbial invasion, yung pagpasok ng microbio sa lung tissue ng patient. Next is, what are the classification of pneumonia? There are 4 classification of pneumonia. They are community-acquired pneumonia, healthcare-associated pneumonia, the 2 subcategory, which are the pneumonia in the immunocompromised host and aspiration pneumonia, hospital-acquired pneumonia, and also the number 4 classification of pneumonia is ventilator-associated pneumonia. Then, let me discuss about the community-acquired pneumonia. Community-acquired pneumonia occurs either in the community setting. So, in a community setting siya mag-happen or within the first 48 hours after the hospitalization of the patient. Pwede siya magkaroon ng community-acquired pneumonia or sa community niya nakuha yung pneumonia. Then, causative agent nito is the Streptococcus pneumoniae, influenza, Legionella, and Pseudomonas aeruginosa. So, pneumonia is the most common cause of the community-acquired pneumonia in people younger than 60 years of age. So, pwede mag-cause to sa mga people younger than 60 years of age. So, para naman sa children, pneumonia in infant and children, yung causative agent naman nito is the viruses. Next is the healthcare-associated pneumonia. Healthcare-associated pneumonia is occurred when the patient is hospitalized for 2 days in an acute care facility within 90 days of infection. Pwede residence siya, inpatient, in a nursing home or long-term care facility. Then dito na siya nakatira, inpatient. Pwede rin inpatient if nagtitake siya antibiotic therapy or nagti-chemotherapy siya or on siya wound care within 30 days of current infection or nagka-infect siya. Then, pwede rin through hemodialysis treatment at a hospital or sa clinic. And then, pwede rin through home infusion therapy or home wound care. And then, pwede rin siya ma-acquired ng patient yung pneumonia through family members na which is infected din siya ng multi-drug resistant bacteria na which is ito yung common causative ng healthcare-associated pneumonia. So, as a subcategories, number 1 is the pneumonia in the immunocompromised host. Ito yung mga people na madali silang mahawaan ng sakit. Mababa yung immune system nila. So, ito yung mga immunocompromised host includes pneumocystis pneumonia, pwede silang magkaroon ng ganun, fungal pneumonias, and mycobacterium tuberculosis. Also, pneumonia in immunocompromised host may cause mga causative organisms or microorganisms na nag-cause sa patient with the immunocompromised, mababa yung immune system niya, pwede nating makita yung mga causative agents sa hospital-acquired pneumonia and community-acquired pneumonia. Next is number 2 subcategory of the healthcare-associated pneumonia is the aspiration pneumonia. Mag-result sa entry ng endogenous or exogenous substances papunta doon sa lower airway ng patient. So, commonly, yung common aspiration pneumonia is bacterial infection from the aspiration of bacteria. Na-aspirate ng patient yung bacteria na nagre-reside dun sa or nakatira dun sa upper airway ng patient na inhale niya napunta sa lower airway ng patient. Also, pwede din to siya ma-occur aspiration pneumonia doon sa community and hospital setting. Pwede makuha ng patient or makuha ng tao. So, ito yung mga common pathogen na that cause aspiration pneumonia. Number 1 is pneumonia, influenza, and aureus. So, next is the hospital-acquired pneumonia. Next classification of pneumonia. It also called as nosocomial pneumonia, and is defined as the onset of pneumonia symptoms more than 48 hours after the admission of the patient with no evidence of infection at the time of admission. So, nakuha niya na lang yung infection, dun na siya sa hospital. So, the common microorganisms that are responsible for the hospital-acquired pneumonia is Enterobacterial species, Escherichia coli, influenza, Proteus, Serratia, Aureus, and pneumonia, and many more. So, next is the ventilator-associated pneumonia. Ito siya, type din siya ng hospital-acquired pneumonia na pwede siyang ma-develop within 48 hours after na yung endotracheal tube ma-intubate siya or mapasok yung tube sa airway ng patient. So, pag yung nurses, nag-happen to siya, pag yung nurses is hindi nag-practice ng aseptic techniques and strategies, possible na magkaroon yung or dahil doon. Next is the nursing process. I'm going to use a nursing process framework to care for the patient with pneumonia. So, kailangan natin ni assessment. Ano yung mga kailangan ni assessment? I-assess natin yung mga napi-feel ng patient, clinical manifestation na nakikita natin sa kanya, para masabi natin na meron siyang pneumonia. Number 1 is, pag may fever, may chill, or night sweat in patient na also has the respiratory symptoms, possible of magkaroon siya ng bacterial pneumonia. And if patient, ipag-manifest siya, diuretic type of pain, dapat i-assess natin kung mayroon siyang ganon. Fatigue, nafe-feel niya ba yung takip niya, the use of accessory muscle for breathing, bradycardia or relative bradycardia, nagka-cough ba siya, and may nilalabas ba siyang purulent sputum. Then, dapat makita din natin ang changes sa temperature and pulses. Amount, i-assess din natin yung amount, odor, and color of the secretion na nilalabas ng patient. Frequency and the severity of the cough, degree of tachypnea or shortness of the breath, changes in the physical assessment findings, kung may change ba. For example, nagsagawa ng yung patient na nag-inspect yung patient doon sa chest or nag-auscultate kung may changes ba doon sa physical ng patient. And also, pag may results sa chest x-ray findings na nagsasabi na yung patient's positive in this disease. We need also to assess the older adult patient for the unusual behavior, altered mental status, dehydration, excessive fatigue, and non-committant heart failure. So, diagnosis based doon sa assessment na na-find out, na-observe ng nurses, na-feel ng patient, na sinabi sa nurses. Ito yung mga major nursing diagnosis na pwede. Based doon sa assessment. Ineffective airway clearance related to copious trachebronchial secretion. So, dahil doon sa copious trachebronchial secretion, nagkaroon ng ineffective airway clearance ang patient. Then, fatigue, nafe-feel niya ang fatigue, and activity intolerance related to the impaired respiratory function. Dahil sa impaired yung respiratory function niya, madali siyang manghina, napapagod siya, and hindi niya nagagawa yung usual everyday work niya. Next is yung patient is dahil dun sa assessment, risk siya for deficient fluid volume dahil dun sa fever and the rapid respiratory rate. So next is the imbalance of nutrition. Naliles than yung body requirements. Kung baka kulang, then dahil doon sa mga symptoms, kumukulang yung body requirements na kailangan ng patient, yung balanced nutrition. Next is deficient knowledge about the treatment, regimen, and preventive measurement. So dahil doon sa mga signs and symptoms, kulang yung patient sa knowledge about the treatment and paano i-prevent yung disease. Next diagnosis is pag may potential complications or collaborative problems. For example, continuing symptoms after initiation of the therapy. So, continue pa rin yung symptoms kahit na may therapy. Then, aseptic and septic shock. Respiratory failure. Ito siya yung pinaka-severe complication of pneumonia. Pwede yung patient magka-hypotension siya, septic shock, and respiratory failure. Atelectasis, pwede mag-close or mag-collapse in alveoli niya. And then, as described in relation to the x-ray and findings or clinical signs and symptoms. So, next is the potential complication is the pleural effusion, which is the accumulation of the pleural fluid in the pleural space. Delirium is a mental state of being confused because because sa mga illness or fever na feel niya. Ano yung plano or goal na pwede natin gawin based on dun sa diagnosis? So, dapat ma-improve in airway patency niya, ma-increase in activity niya. Also, i-avoid in overexertion. Dapat moderate lang muna in kaya niya i-tolerate. Next is ma-maintain in proper fluid volume niya. Kasi nga, dehydrated na siya. Dahil ang mga symptoms and signs na pinapakita niya. Then, ma-maintain in adequate nutrition. Yun yung goal natin. And dapat ma-understand ng patient in treatment protocol and preventive measurement. Then, eto na, nursing intervention na pwede natin gawin. Improve in airway patency. So, possible na i-remove in secretion or removal of secretion. Secretion should be removed because retained secretion interfere with the gas exchanges and may slow recovery. Dapat din, adequate in hydration niya. At least makainom siya 2 to 3 liter per day para matin and malusan yung pulmonary secretion niya. And also, pwede rin through humidification that may loosen secretion and improve ventilation. And then, dapat mag-exercise to siya, coughing exercise. It is an effective directive cough, can also improve airway patency. And pwede rin through chest physiotherapy. It is important because the chest physiotherapy loosen and mobilize secretions. Then, pwede rin i-promote, as a nursing intervention, i-promote ta in rest, mag-rest in patient, and mag-conserve din siya energy. Dapat, encourage na siya, mag-avoid muna si mga overexertion of the works. Mag-rest siya in a semi-floor position. So, the patient should assume a comfortable position. So, comfortable siya dapat para ma-promote in rest niya and breathing niya. And dapat mag-i-change niya in position niya frequently para ma-enhance yung secretion clearance and pulmonary ventilation and perfusion. Next is promoting fluid intake. Dapat inpatient ma-promoting fluid for at least 2 liter per day para ma-replace yung mga sensible fluid losses, yung mga na-lost kanya fluid. So, dapat as a nursing intervention, ma-maintain in nutrition niya. For example, pwede siya mag-take fluid with electrolytes para ma-help mag-provide fluid colors and electrolytes. Dapat mag-consume din siya nutrition-enriched and beverage. Naturally enhanced drinks and shakes can also help restore proper nutrition. And then, pwede rin through IV of fluids and nutrition. Pwede rin siyang ibigay if necessary. Then, promote ta in patient knowledge. It is important. Dapat ma-instruct na yung patient. Also, family. About the cause of the pneumonia, management, paano siya i-manage in symptoms. Uno naman yung mga signs and symptoms para aware sila. And kung need ba in follow-up para mas sure bang why na in sakit ito. So, dapat ma-instruct din yung patient about the factors that may have contributed to the development of the disease. Dapat iwasan nila yung mga factors na maka-affect sa disease na para hindi siya lumala. Then, monitoring and managing potential complication. Dapat ma-monitor na to and ma-manage na to in mga complications ini. Like for example, continuing symptoms na makikita natin after the initiation of the therapy, yung mga shock and respiratory failure, pleural effusion, and delirium. Next is promoting home, community-based, and transitional care. Dapat, number 1, is educating patient about the self-care. Dapat maingat siya, baran niya, maingat siya makayupot simbaran niya. Dapat ma-educate siya about the proper administration of the antibiotics. Dapat hindi niya ito kalupahan, continue siya para continue rin recovery niya. And then, yung mga potential side effect, dapat kaingatan niya. Like for example, difficulty breathing, worsening cough, increasing fever, and medication intolerance. Next is the continuing and transitional care. Dapat, if the patient is outpatient siya, during the home visit of the nurse, dapat i-assess niya inpatient physical status. I-monitor niya yung mga complications, bang ba? I-assess niya in home environment, which is na maka-affect ito ang condition si patient. And dapat ma-reinforce yung mga previous education na dapat kaingatan si patient. So, in evaluation, after sin assessment, diagnosis, and nursing intervention sa mga plano naghihinang ta, dapat in outcomes or ma-meet si patient in goals ini. Like for example, ma-demonstrates improvement airway patency, na which is the evidence by the adequate oxygenation. Pag meron na siyang improved na yung airway patency niya, adequate na yung oxygenation niya, which is can be measured by the pulse oximetry or arterial blood gas analysis, normal na yung temperature niya, normal na yung breath sounds niya, and effective na yung coughing niya. Then, rest and conserve energy by limiting activities and remaining in bed while symptomatic, and then slowly increase the activities. Then, Dapat ma-maintain din in adequate hydration. As evidenced by the adequate fluid intake and urine output and normal skin turgor. So, ma-maintain in adequate hydration pag nakita mo yung urine output niya is normal na and normal na din yung skin turgor niya. Hindi na siya dehydrated. Then, mag-consume din siya adequate dietary intake. Pag na-consume na siya dietary intake, pag nakita natin yung patient, na-increase na yung body weight niya. Pero dapat iwasan niyo yung excessive fluid gain kasi another complication na naman. Then, dapat ma-verbalize na sin patient na mag-increase na in knowledge niya about the management strategy. Then, ma-comply niya nakatan si mga management strategy para mas tuloy-tuloy yung paggaling niya. Then, exhibit no complication. Dapat wala ng mga complications na kakitaan mo ha patients. Then, mag-exhibit na siya acceptable vital signs, pulse oximetry, and arterial blood gases measurements. Then, ma-maintain niya or ma-increase in weight niya with no fluid excess. Then, adhere to treatment protocol and prevention strategies. So, pag na-meet to ng patient, lahat ng evaluation based on sa assessment na ginawa, and then na-implement yung nursing intervention, mabas itong evaluations, the goals met. Pag hindi na met yung goal, pwede yung patient i-reassess or pwede yung nurses, dagdagan niya yung nursing intervention na para mas maging effective yung plano niya and maging effective yung nursing intervention niya para ma-meet in goal. So, that's all for today. Thank you.